There are three important diseases that we need to think about when we're learning about the pathology of joints: osteoarthritis, rheumatoid arthritis, and gout. Osteoarthritis is a really common disease. In fact, it's the most common joint disorder, affecting up to 80% of people over the age of 55 years. We call it degenerative joint disease rather than osteoarthritis now. Why? Because arthritis implies inflammation, and this isn't about inflammation, it's about degeneration. In osteoarthritis, what we get is progressive erosion of the articular surface, the articular cartilage. This happens because its degeneration exceeds the rate that synthesis happens. There are two kinds of degenerative joint disease, i.e. osteoarthritis. The first is primary degenerative joint disease. This happens with age, and it affects only a few joints, the weight-bearing joints, for example, the knees and the hips. In women, the hands can also be affected. In secondary degenerative joint disease, it can occur at any age, and it occurs in previously damaged or congenitally abnormal joints. For example, if someone has really bad knee trauma, they're at risk of secondary osteoarthritis in there. If someone has gout and has crystals deposited in those joints, then they're at increased risk of osteoarthritis. Similarly with hemochromatosis. So this picture here describes the evolution of osteoarthritis. A normal joint undergoes degeneration of the cartilage, which leads to changes in the underlying bone. And those changes include cyst formation and erosion. Eventually, all the cartilage goes away and all that's left is a sclerotic surface. Sometimes bits break off and we get these little tiny bits of bone, joint mice they're called sometimes. They give that locking feeling in joints that people get with osteoarthritis. Here's a histologic picture. You can see that the cartilage is really thin, and underneath, particularly in the upper part of the joint, we're getting some kind of sclerotic changes there. The bone cysts are quite hard to see in this picture, but you'll notice that the trabeculae are quite thin. Having osteoarthritis doesn't mean that it excludes osteoporosis. We quite often see both together. The most notable feature in this histologic section is that weird little bit of bone popping out the side, and that's an osteophyte. So osteophytes are new articular bone growth that happens at the edges of joints with osteoarthritis. They can be seen in small joints in the hands and in larger joints, for example, around the spine. Here are some pictures showing other changes that are seen in osteoarthritis. The first is a picture of the joint mice, the loose bodies that can cause locking, particularly in the large joints like the knee. Heberden's nodes are an eponymous name for the osteophytes that occur around the small joints in the hands, particularly the distal interphalangeal joints in women. Osteoarthritis in the hands of women can be an inherited condition. It isn't due to joint trauma. Rheumatoid arthritis is one of the great success stories of modern medicine. You've all seen the old pictures of women with terribly deformed hands with ulnar deviation. Now we don't see it because we have effective treatments. Rheumatoid arthritis is a chronic systemic inflammatory disorder, and the modern treatments are really good at turning down that inflammation before the joints are affected. While rheumatoid arthritis principally affects the joints with progressive damage over years, it also can affect the blood vessels, skin, heart and lungs, together with the muscles, because it's a systemic disorder. About 1% of the population will get rheumatoid arthritis, and it's much more common in women, starting in their midlife years between the ages of 20 and 50. Thinking about the pathogenesis of rheumatoid arthritis, it's associated with certain major histocompatibility gene types, and a genetic predisposition is being clearly established. In rheumatoid arthritis, large numbers of antigen-presenting cells and T helper cells are found in the synovial pannus. The synovial pannus is the layer of inflammation which lies on top of affected joints. Activated B cells are also present in the joints. They produce rheumatoid factor that leads to the formation of immune complexes. These complexes perpetuate inflammation and destruction of the underlying bone. Another common finding in rheumatoid arthritis are rheumatoid nodules. So these present as non-tender nodules in subcutaneous regions, particularly those subject to recurrent pressure, for example here on the elbows. What they're due to is necrosis, an area of collagen necrosis caused by the immune reaction, particularly affecting blood vessels. This is surrounded by a granulomatous inflammatory reaction. It all swells up and forms this quite distinctive nodule. Gout. It's a pain in the big toe. Literally, the classic presentation is described as an imp nipping at the big toe in the middle of the night. This classic presentation is accurate. Gout sufferers wake up with incredible tenderness and pain, particularly in the big toe. It's due to too much uric acid in the blood, which leads to precipitation of sodium urate crystals in joints. This causes synovitis and destruction of the underlying bone. What we see down the microscope is an acute arthritis with neutrophils infiltrating the area and long needle-shaped crystals from the uric acid. Now, the uric acid acts as a foreign agent and causes a granulomatous reaction, particularly when it's deposited in soft tissue. These deposits are called gouty tophi. Gouty tophi are seen as small white lumps, particularly on the fingers, on the elbows, and sometimes on the ears. So we've thought about some common and important diseases of joints. Osteoarthritis, which will affect nearly all of us. Rheumatoid arthritis, the big good news story in joint disease. And gout, which is due to increased uric acid. We can modulate the amount of uric acid in our blood, either by diet or by medicines. But there's always that important genetic component. Genetics runs through all these three diseases. In women who have a tendency to get osteoarthritis in their hands, in rheumatoid arthritis with its major histocompatibilities association, and gout with a tendency of some people to have increased uric acid.